Hi there, my name is Dan Sokulski. I'm a recovery support specialist with Chestnut Health Systems in McLean County, Illinois, and a member of the McLean County ROSC. You can find our videos on YouTube. Please check us out. If you like them, smash the thumbs up. But today we want to just talk about harm reduction. We do these videos periodically to educate, build awareness among the public. So today we thought harm reduction is a good thing to cover. It's a bit of a controversial field, as we'll talk about, and you could probably figure out for yourself why that might be. But basically it came about in the mid-'80s from the AIDS crisis around 1986. In the early 90s it started to crystallize out in the Bay Area, San Francisco, Oakland, some social workers basically just getting together to try and do something about this AIDS outbreak. So they do things like clean needle exchanges and giving out condoms and helping with testing for STDs and medication to curb hepatitis and that kind of thing. Fast forward a couple decades, it definitely showed to have impact in the studies they did as far as reducing the amount of positive infections in their area. So today we're kind of looking at it with the opioid epidemic. Similar pragmatic approaches that borrow from kind of what was being done through harm reduction in the 80s and early 90s. So it still includes a lot of the services, clean needle exchanges so people aren't reusing needles, spreading infections, and condoms for sexual, curbing STDs, but it also includes things that are more focused to specifically substance use disorder as a primary illness, and that includes MAT and MAR, so medication-assisted treatment, medication-assisted recovery is a big part of harm reduction. Here we're talking about Suboxone, methadone, Vivitrol, these kind of treatment programs where people in active heroin addiction or fentanyl who are shooting up every day and basically being slayed by the dragon, they get into these programs and it helps them to not only detox off of the long-term opioid addiction, it also treats their brain, I guess, in some of the same ways that the heroin does. It kind of fills those opioid receptors, but it has the naloxone in there in the case of Suboxone to limit the level of high a person can feel. So when taken properly, it's proven to be very effective in treating people for opioid use disorder. Vivitrol, simply a shot that somebody gets once a month, and it's time release. So over the course of 30 days, it releases their dosage, and it helps with curbing cravings for both alcohol and opioids. Some other things that are a little bit more radical coming out of the harm reduction space, and kind of a new things, these supervised consumption services. There's the first one came up in Ontario. I just saw a news story last week about one in the United States, but these are basically clinics that people can go to who are in their active substance use disorder to safely inject. They'll be in a supportive environment where if they want knowledge about recovery, they can have access to that. But if they just simply want to get high with clean needles and pharmaceutical grade heroin, to do it in the safe possible manner, then they can do that. A little more history about harm reduction, kind of just jumped into the services there. It's developed, they say it's developed by and for people who still choose to use and recognize that a lot of people just don't or can't deal with total abstinence. It's hard to go from a lifestyle of daily usage where your every thought and obsession is driven about finding that next high, and you're doing all sorts of illegal and probably acts that go against your own value system to make that happen. But it's hard to go from that lifestyle, many people decades of doing that if they live that long, to now you have to be completely abstinent, you can never use or drink anything for the rest of your life, have fun. That's just a tough thing for a lot of people to deal with. So with the harm reduction approach, it's kind of more, hey, they were shooting heroin, but now they're just kind of like smoking cannabis before bedtime, or to help with anxiety. What's going to keep the person alive? Really, harm reduction, I think, and my interpretation is about there is no perfect solution in recovery. There's a lot of different options. There's nothing that's perfect. But let's just keep the people alive, keep them in the game, so to speak, and then kind of just getting from that one day to the next, with the hope that maybe abstinence is something that they will want to pursue once they get a little taste of what a recovery lifestyle can be like. We talked a little bit about how it parallels today's opioid epidemic with the AIDS crisis from decades ago. It's really about just reducing the harm from using or drinking. It's not about continuous abstinence, and it's I look at it as sort of just a pragmatic, practical view about people's relationships with substances. And harm reduction doesn't have like set tenets or steps, like you might see in other programs, but they do have some core principles that they follow. Let's talk about those. So some of the core principles that harm reduction adheres to, one is just kind of this definition of recovery. It's not really their definition, but a lot of what the teachings are in harm reduction kind of boil down to, you're in recovery if you say you are. And this is a slogan that I first heard from a C-car training, and at the time it was a little rattling to me, being a 12-step person and, being so bought into specific sober date and continuous sobriety, and anything other than that is not really recovery. Well, harm reduction and some other programs are kind of just challenging us to look at recovery a little bit differently. Is abstinence recovery? If you are working a harm reduction program and you're still alive, you're starting to feel connected to things bigger than you outside of yourself, your relationships are improving, your self-esteem is improving, you're working. Those are all things that look like recovery and probably feel like recovery. Who am I to tell somebody that their recovery program is bogus compared to mine, that kind of thing, when they're experiencing some of these payoffs and really miracles that we all seek in recovery. I think it's about really the outcome, not really how we get there. Another principle, just any positive change. Hopefully we've talked about this, incremental progress, to borrow from a 12-step slogan, progress over perfection, a positive change. If somebody is sharing needles, using dirty needles, and they start going to a needle exchange through a harm reduction clinic or something, that's a positive change. That's a step towards recovery. Nothing about us without us. That's basically just the idea that harm reduction members, I guess you could say, are very involved with just laws about drug use and legalization and laws about criminalization of recreational use. So just trying to help advocate for people. Another principle, said this a little bit earlier, drug use is here to stay. The war on drugs from the 80s really didn't do much. So I think we just need to accept this fact as just part of human nature from a harm reduction perspective. And people have their own relationship with substances. Just because when I put alcohol in my body, it's a matter of time till I'm off to the races and experiencing the phenomenon of craving and the mental obsession to drink or to use. Just because I get that doesn't mean that other people do. So we talk a lot about cross addiction in treatment centers. If you're an opiate addict, and then you start using benzos or something, you're just substituting one for another. But we can't always assume that somebody is going to cross addict. There are instances that we talked about where if somebody is going into a MAT program from regular street drug opioid use, or for anxiety, maybe going from a horrible Xanax addiction to legalized cannabis. Those, from my perspective, from a lot of people's perspective, that is progress. Just because that might not work for one person doesn't mean it can't work for another, is what we're trying to say. And there's no hope if a person's dead, so harm reduction, a big part of that is just preserving life during this period of crisis. This person's literally going to die any day from their addiction, and they're out there on the streets doing all sorts of things. Let's just keep them alive, like we talked about, until maybe we can introduce some of these treatment options or recovery programs, and that'll have some appeal when they finally have their moment of clarity. And just giving people options. We're learning over time recovery works best when it's person-centered, and we're choosing our own recovery path, not having one foisted upon us. And a big part of harm reduction is just meeting people where they're at. You're not ready to stop. Well, let's see if we can, reduce that, 20 beers a day down to maybe a 12-pack, or the 2 packs of cigarettes a day down to a pack and a half. Where are you at, and what's kind of that next step of progress that we can make to get some positive changes. So as you can imagine, there's been quite a bit of debate, and there's some antagonists to this harm reduction approach. Okay, so some of the pros and cons about harm reduction. Probably figured out some of them yourself as we've been going along here. Of course, one of the pros, it reduces infections and therefore deaths. There's studies that accredit this. People, I mean, a pro for a lot of people is they can still chillax. Maybe they're not using death drugs anymore, but in a harm reduction program, they might be able to still have recreational or medicinally use something that kind of helps them with their anxiety or take that edge off. Harm reduction shies away from what might be termed disrespectful methods of treating people in recovery. An example of that to somebody new might be going to a meeting and they've come out of treatment, maybe added another 32 days to their sobriety after treatment, and so they get a 60-day medallion. Come in the next day and they're feeling really good about that medallion. People are congratulating them. Something happens, they have a drink the next day, they go back in, tell people in their meeting, and suddenly it's like they're starting over, and the 60 days that they had and the 28 days of treatment, everything they went for is kind of maybe feels like it's just been thrown aside, discounted. When I look back at my own experience, there's about 7-8 years where I struggled in and out of treatment centers and would get a little bit of time, stop doing things that were working, and go back to using once I got restless, irritable, discontent. When I look at that on a whole, I think about when I see pictures from those years, when we talk about like some of those memories with my family, I immediately get this like knee-jerk reaction that, that was negative. That's when I was still using or struggling, and I just you just get this just bad feeling when I even see pictures, but really, realistically, about 90% of those days over that period of time, I was sober and trying to be in recovery. Prior to that, my college years when I was actively using, if somebody told me over the next 7 years, you're gonna be sober 90% of the days, I'd have been amazed. I would have thought that was a miracle. I'd have signed that contract in a second. But working the recovery style that I was, with the program, every setback felt like a failure. And in retrospect, I can draw from all those different experiences, piece it together, learn from it all. A return to symptoms, when you have an illness or a disease like addiction, we shouldn't be shamed for that. It's just a natural course of when you have a disease. So harm reduction, tries to shy away from some of that, what could be termed as negativity from, a relapse or something. Just don't disqualify people over medications they might take. I don't see it as much personally in 12-step meetings, but there is kind of reputation that people, old timers might tell new people, to get off their antidepressants or depression medications and get off all medications. We know today that's recklessly dangerous. We're not doctors. That should be between each individual and their prescriber, what they're taking. And that individual can check their own motives if that's something they truly need or if they're doing it to get a high. We gotta be real careful about trying to play doctor. Harm reduction stays away from that. In fact, they encourage a lot of the medications that help people get off of drugs and stay off of them. Easy access to services, less stigma around substance usage. It's just an additional recovery option path for somebody to explore. There's really probably not, I'm sure there's been studies. I'm just thinking about this like realistically. There's not going to be increased use of drug users because there's needle exchanges on the street corner, or because people can go to some of these supervised consumption services. I'm not gonna, my parents aren't gonna, or somebody who doesn't use have a conversation over dinner about a needle exchange opening in town and be like, hey, let's go shoot up some heroin, when they've never done any of that stuff their entire life. So it really doesn't increase usage, more than likely. And a person can always seek abstinence when they're working a harm reduction program. If they're continuing to see positives in their lives from less substance use, then maybe abstinence is an attractive program for them. Some of the cons, or the detractors say funds that are that go to harm reduction are being diverted. That's money that could be used to expand abstinence programs. I'll be honest, I don't think we need more abstinence treatment programs in this country. I think we have a lot of them. We have a lot of good ones, we have a lot of bad ones, but we have a lot of them. I think it's more interesting to see what different approaches might do for people and expanding some of these other recovery programs. I'm a 12-step person. If you're watching this, you're a 12-step person. I'm not trying to rattle any cages. You know, we all know we find what works for us. But we got to recognize that out of all the people seeking recovery, very few of them actually, get much traction. And then out of those who, out of that certain percentage, not a lot of them are going to 12 steps. So there's a lot of people we're missing. Is my point. We got to try and cast that net wide enough to catch everybody. They feel that it'll prolong drug use. You're not, if you're not having them stop right away, you're sort of encouraging them to use maybe like lighter or other drugs. And that's really just substituting one thing for another or extending the problem. So they feel it encourages or enables. There's this idea that's just really a Trojan horse argument. The whole thing is really about trying to get pot legalized, and that's why they want the funds to get lobbyists to pay and that kind of thing. Not for everyone, of course. It's available to everyone, but it's not for everyone. The real alcoholic, the real addict, as it talks about in the big book, most of us know from our own experience, the idea anymore of just having 2 beers, after dinner, or a drink to take the edge off is not an option. That stuff goes in our body. We're off to the damn races. But not everybody's that real McCoy. There are people who can control their use based on external factors, based on pressures, ultimatums, consequences. Promotion of cross-addiction, kind of talked about that. And just peer pressure in recovery circles. This is really a big deal. I could do a whole video on this, and probably should. Just the idea, you're not really clean if you're doing all this. And again, who's the recovery god out there? Who's the arbiter deciding what recovery is for every single individual? I don't think that there is such an entity, nor should there be. I'll just speak from my own experience. I've been on Suboxone maintenance program, and I was doing well with it for over 2 years, and because of these types of pressures from family, just my own sort of mental dialogue, trip that I put on myself, I ended up getting off of it rapidly and without really a plan. Consequently, was in for a lot of suffering for several weeks, not knowing how long it takes to come off of it. Ended up using, of course, because that's what we do when we're in a state of discomfort and withdrawal, and was back in treatment after after having 2 good, relatively happy years. So this is also dangerous stuff. I don't know why we think we need to get in other people's business about what their recovery needs to look like. Just worry about our damn selves and we'll all be fine. So really, just to summarize, harm reduction is about keeping people alive, giving them options, destigmatizing substance use, normalizing it. We do this with mental health, we do this with suicide, the normalization. In order to reduce stigma, we need to do it with substance use, I think, too, because it is an embedded part of our society. So it's, rather than ignoring it or trying to completely eradicate it, let's be realistic and look at options of what we can do within that reality to help people. And I think harm reduction does a pretty good job of that. It's up to you to decide if it's for you or not, but hopefully you'll learn something about it. And if somebody asks you about it that you work with, or you're considering it yourself, you got a little bit more information. I want to thank you for watching this. Again, McLean County ROSC. If you did like it, please hit the thumbs up button and subscribe, and we'll see you next time. Thank you.